Services Committee. Roll call, please.
Mr. Erickson.
Here.
Mr. McCormick.
Excused by the chair.
Mr. Beggs.
Here.
Mr. Hardy.
Here.
And Mr. Walker.
Here.
Approval of the minutes of February 12, 2026.
I'll make a motion to approve.
Support Walker.
Moved by Beggs, supported by Walker. All in favor say aye.
Aye.
Any opposed? Motion carried. Changes to the agenda. Would there be any changes to the agenda this morning? Hearing none, we'll entertain a motion to approve the agenda as written.
I'll make that motion, Hardy.
I'll support.
Moved by Hardy, supported by Beggs. All in favor say aye.
Aye.
Any opposed? Motion carried. Public comment. Would we have any public comment at this time? Hearing none, I'd like to introduce Mr. James Kelly, our District MSU Extension Director.
Good morning, James.
Thank you. Thank you. We've just had a quiet wager in the back, the 3 annual reports today about who can speak the longest, so someone start the clock.
You're first, you lose.
Again, I will be brief. You have a busy presentation schedule, I understand, so I appreciate the time. 7th year presenting this, I believe. 109 years of formal partnership between Oceana County and MSU Extension, so lots to kind of be appreciative of it when we stand up and give these annual reports. Just a quick review. The current communication plan that I'm following is a annual report, of course, which is going to focus a little more on the data. You're receiving a monthly email, I believe, from me, which is a little broader perspective statewide in what we're doing through Extension. And then, of course, the quarterly communication specific to activity in Oceana County, and a little bit more of the storytelling, more in depth of what we're doing. So I hope that kind of balance is working for you. If not, do give me feedback. I'm certainly open to that. So today I will review the report, which I believe you have electronically, hopefully in front of you.
Yep.
And just highlight a few things on each of those pages and wrap up pretty briefly after that. But on the first page, I think most importantly, it's important to recognize the staff that are currently operating out of the Oceana office. So we have some names on there that are familiar to lots of you, and perhaps a few that you haven't had as much exposure to. But we've listed everyone, and that includes Riley Ford, who is a research assistant who works technically up on a lot of time up on the research station, but she's working for one of our educators. Emily Laidley, who is our tree fruit educator, and also does some work for Ben Whirling, who's the vegetable educator. So again, in my district of 5 counties, Oceana County is certainly the best staffed with in-county ag support, which makes sense. We're very lucky to continue to have Kathy in the office for another year. She's up to year 33 or something like that, so I'm just thankful each year that I get to share her name and hope that she sticks around for another. Amber Pumford, who supports our 4-H program with some administrative support time. And that is our current staff. Again, you'll perhaps remember that we lost one of our staff due to loss of SNAP-Ed funding, so we had a community nutrition person who left our organization around August. On to page 2. So the primary numbers in all the counties I've been presenting to, I've kind of highlighted the numbers that I might want to refer to in terms of where we've seen some growth. And if you look at my page up here for a moment, you'll see that every number is highlighted. So it's a beautiful picture in Oceana County. Increases in people reached, increases in programs in county, increase in programs that Oceana County residents are attending, whether they're in county or across the state. So every number on that page in terms of the overall impact numbers is an increase from last year. So that's a good sign, especially having lost one staff for 6 months of the programming year. I like to highlight a little bit about our communications reach. So we have 204,000 contacts through social media, web activity, newsletters, handouts. There is a lot of information flowing across the internet, through the mail, through various mechanisms. A lot of that hits our Facebook page. Again, I hope most of you are following the Oceana County or 4-H pages for the Facebook updates, which continues to be kind of our primary mechanism in many respects for getting information out to our community. We continue to sell a lot of book soil tests and other resources up out of the Griswold Street location. The number there, 925, is a little inflated because Kathy coordinates some of the purchases that get sold down at the Great Lakes Expo, which is a big regional fruit and vegetable event in Grand Rapids each year. By the way, jump in with questions at any point if something strikes you. Youth programming, again, very good numbers. Some of you, again, I was pleased to see Chairman Walker, Commissioner Erickson, Commissioner McCormick at the Ag Banquet where 4-H was highlighted, and some of their recent activities and their youth experiences in terms of sending folks to Washington. But the Oceana County certainly is thriving under the leadership of Jennifer Payne. There was about a 60% increase in overall youth participation, so that includes not just the traditional club members but just other one-time events, and there have been a lot more of those activities. Jen has a true passion for what she does, which I think was evident in her presentation, and that's just being really well received by the community, by adults who are stepping up to volunteer, and again, the program is thriving. Some of the stories that are highlighted in that section, I continue to just talk a little bit about the Teen Mental Health First Aid, which I've shared with you before. So we are working with Shelby and Hart in terms of presenting some mental health first aid training that has had some pretty big impact. And again, I hope you take the time to read the individual stories that we've highlighted for some of these sections. The county fair continues to be a big part of 4-H, and I would suggest it was a great fair, and things ran pretty smoothly this year. The auction continues to be a big part of the fair program, and certainly 4-H's involvement and record numbers in dollars contributed by the community, which is really what I look at. It's just a massive amount of support to our youth involved in the ag sector. And then we sent 3 Oceana County teens to Washington for Washington Focus. Again, I think that's an important part of the program to recognize the value of 4-H, is getting folks not just involved locally but expanding their horizon to some other experiences. And moving on to page 4, Community Health and Nutrition Program. Again, that's where some of the numbers will fade. Certainly they faded a little bit this year or in 2025, and they will again as we've lost that staff person permanently, which is again disappointing. It's always tough to stop and reflect on that, just because there was important work being done in terms of nutrition education, how to get more from your SNAP dollars, how to be active and live healthy, and working with schools and early childhood centers and senior centers. So more recently we have been switching to policy systems and environmental education, which is trying to affect big picture, like working with the school system on changing their food service policy, and that way our reach was a little larger. But again, sadly that has come to a halt for the moment as we pursue additional funding from other sources along with many other agencies who've been affected. We don't have an answer right now in terms of whether that will come back, but we're hopeful that at some point we will be able to reintroduce that piece of our programming that existed for about 30 plus years for us. I'll move on to page 5 and start just digging into a little bit of our ag work. And again, the protecting carrot crops. If you didn't read that section, read that story. That's a great story talking about the impact of our services and the fact that we basically saved someone's 2025 carrot season and $420,000 worth through some very targeted education and support to a local grower. The West Central Irrigation Day is in our report as evidence of the new work that's being done by our new educator based out of Mason County, Brendan. So he is kind of expanding his reach, but it's again excellent to have another ag focused person in the district. Brendan, by the way, a little plug, if anybody in the room has any kind of accommodations, he has relocated from the southern part of the state. He has been struggling with rentals up in the area. He wants to invest in something very, he's talking about a shack in the middle of the woods. He's a single guy, a young guy, he can live pretty simply, but if you have property or housing, let me know, because he is desperate to find something to invest in that will keep him here. I like to include a page on the Research and Extension Center. Obviously that is a huge asset to the region, and specifically and especially benefits Oceana County with just a massive list of diverse events focused on different aspects of the ag community. Technically that's housed within Ag Bio Research, which is another department within our college. But our staff work very closely with the farm managers, and we have research that's happening there, and again, we're just so thankful to have that facility to continue to support our ag community. I'll move on to page 7. A couple of other pieces just to highlight some of the work of other staff outside of Oceana County. The Steelhead Sustainability Research, which is done by Dan O'Keefe. He sits in Ottawa County, but he's doing research up and down the west side of Michigan, and has done some significant data collection, working with some other federal and state agencies, and specifically looked at some of the steelhead population in Oceana County. So I thought that might be an interesting story, because you probably haven't heard much about that. And then Conservation Stewards is another program that we brought into Oceana County at the end of last year in the fall. Gary McKean, I don't think he snuck in, but he was a key person in bringing that program into the county. That brought training and resources to 24 community members on how to manage conservation projects. Where do you get the funding? How do you work effectively and collaborate with other agencies, and ultimately trying to provide the tool set for these participants to then take on some projects in the county. So just having that in the county will have some long-standing impact in terms of future conservation projects. Conservation District was a significant partner in that program. Moving on to the final page, which talks a little bit about our local governance support. So we've had residents take our different parts of our governing essentials programming. We've provided zoning board of appeals training specifically in county from Mary Riley, who sits up in Manistee County. But I think most of you are aware that the local governance piece is an important part of our operation. Most of you went through our new commissioner training at one point. And we continue to throw out very targeted training. The last ones I saw was short-term rental zoning and policy, which is a big issue in lots of communities. I'm assuming it's an issue in certain townships here as well. There's a lot of talk, of course, related to solar developments and data centers, and we continue to try and provide just data-driven education that will help communities make wise decisions. So encourage you to always think of us if you're having some kind of local governance challenges, or you're aware of townships that are struggling with issues. We have a great support team. The final piece on the lower half of that page talks about the Product Center, which is our small business support. We had 10 clients, so these are small businesses who are looking to further develop their products and bring them to a larger market. So 10 clients in Oceana County, 227 hours of counseling. We work with folks like the Starting Block with the Right Place, so we do try to kind of fill those collaborative gaps and needs and make sure that we're just providing as much support to folks who are looking to invest in the county by building a business in this county. So I like to highlight that too, because it's not an area of extension that necessarily gets a lot of the spotlight. So that was a very quick rundown, in my opinion, of our activity. I do want to take a moment to thank Paul Erickson. America Estrada also sits on our District Extension Council, so every quarter we have a meeting where we try to highlight some of our programming and also collect some input from our local communities to help guide us. I also want to just share some appreciation for the office up on Griswold Street, because I don't always get to do that or think to do that, but we are certainly very appreciative of that space. Since I know at one point last year I think I mumbled about not having enough room up there, but with the loss of the community nutrition instructor, I now have an office back. So we are quite settled at the moment, and again, very appreciative of that space. I'll finish with my normal finishing thought, which is we will continue to be as effective to some extent as as we are engaged by members of the public and key members of the public in terms of leadership groups. So I just encourage you to continue to keep us tucked away as your number 2, 3, or 4 resource that you might think of when you come up against a challenge in your world, regardless of what that is. Extension is the window into local resources, regional resources, and then the university itself. And I am very confident that regardless of the topic, I can add some value to the discussion in some ways, and sometimes it's really significant resources. So please continue to engage with us and encourage others to engage. So with that, I'll pause and take any questions.
Mayor?
Yes, sir.
One quick question for you. I know Michigan State was working on it, but the agrivoltaics, because of the
Yes.
solar farm out there, and I think, is it Central Michigan University involved with that, or?
I don't know about Central, but Paul sat in on a meeting where we had a presentation from Charles Gould, who sits in Ottawa County, who was a great presentation. He has been, fortunately, working with various solar projects to try and diminish a little bit of that loss of ag land concept, which it is a loss of ag land, but there are some dual use purposes that can happen with grazing and with pollination and a few other things. So I was really encouraged. I think he's working with the Griner Farm property and has been involved from an early stage, and that's what's the key to influencing the development, is getting that outside education in to work with the developers before contracts are
Before they go.
signed. And Charles Gould will happily give you a list of some developers who are agrivoltaic friendly, meaning they're happy to consider dual purpose developments, and those that are just looking to cram every square inch with structure.
Panels,
Well, I'm glad they're working on it.
Yeah, I was pleased to hear that Charles was involved with the project, but again, there's so many of those around, which unfortunately some of them are just tearing ahead without any thought to that. So.
Yeah, pollinators was one of the fascinating things, and then working on some row crops was another very positive that came from that. So we did hear some good things to alleviate some of the fears.
I know there was some discussion on raising them as well, and I think that might have been in their study, you know.
There's a lot of, that's a much longer discussion. There's a lot of stuff going on. Thinking about the apple orchard trellises, we're going to be running a trial up at the research station about putting solar panels on top of the posts that are already existing, and kind of seeing how they interfere, or if they interfere. And there are some studies that suggest that they actually help the fruit production, because providing some shade is okay, and preserving some of the moisture in the soil. And so there's continued study to be done, but it's all pretty fascinating, I think, and pointing towards some good solutions to some real problems.
Thank you.
Any other questions? I'd like to thank you, Mr. Kelly, for Extension's participation in the fair, and Jen Payne's role, and we have seen some very positives at the fair, and a record-breaking auction again this year, and all the barns, other than horses, have been very full. So very positive, and to see some more kids coming back, thank you very much.
Well, not my work, but certainly
Jen
and Extension and the community, really. It's a community program which relies on volunteers. So. Thank you.
Thank you, James.
Thank you. We had that time in there, all right.
Yeah.
I'd like to introduce Mr. Kevin Hughes, our district officer at District 10.
All right, good morning, everyone.
Good morning.
I do have copies of our annual report. I apologize, I was off last week, so I wasn't able to get those to you in advance to be in your packet, so we'll send them around. There's also another flyer in there related to our community health needs assessment and the community health improvement plan. I think last year when we were here, I had one of our epidemiologists along with me, Chelsea, and she kind of discussed and reviewed what came from the community health needs assessment, and so the community health improvement plan is that sister document to the community health needs assessment. So that once I, at kind of the end of my just update to provide to you. So the annual report itself is put together pretty similar to how it's been in the past. Starts off with a letter from Dr. Morris, our medical director, and myself, moves into kind of a breakout of our finances, and then some departmental, divisional type stories or information, and ends with everybody likes to go to is the data that covers the 10 counties. Everybody likes to see where their county kind of compares with the other 9 counties in the jurisdiction. So the theme for this year's report, or 2025's report, was adapting through challenge, and 2025 was a challenging year for the local health department. We did end up eliminating 41 positions at the health department, and saw our budget go back to where it was pre-pandemic. Right now, staffing levels and budget-wise, we are back to where we were, almost identical to where we were prior to the pandemic. Now, despite those reductions, we still saw an increase in our overall service numbers that we provided. A little over 11,000 services across the jurisdiction that we provided despite that. So, which that's the first time since the pandemic that we saw that significant of an increase. So we'll kind of be monitoring that as we move forward. Oceana County tends to be one of our busier counties for well and septic permits. So despite everything, we did add a second permanent sanitarian to the Oceana County office to hopefully kind of speed up that permit process and be able to address issues in the community. So it's a younger individual. It'll take a little time for him to get to speed, but working with Matt, I have no doubt that he'll get his legs and be able to move pretty quickly. So, some other things, more unfortunate, I guess, due to continued flat funding from the state, we did have to go through and put a environmental health fee increase in place that covers a large environmental health services. That's the first 2018-2019 that we have had to increase fees for environmental health services. So honestly, we do get, we get funding from the state, we get funding from the locals in terms of appropriations, and then it's fees. And so it's balancing those to, address the requirements of providing services as well as the cost of providing those. So we'll stay on that. I think last year when I was here, I also talked a little bit about that statewide sanitary code bill that is hanging out there and seems to pop up every now and then. It raised its ugly head again. I don't believe it's going to go anyplace, even if it makes its way through the Senate. I don't think that's going to take it up or do anything with it at this time, but I'll keep you abreast of that. Some new things that we did start in 2025 was providing Hep C treatment through our family planning clinics that we offer, and then we also opened up some telehealth services, both for school health and for our family planning services, to increase access to individuals to get those treatments. The other thing to touch on is, I think generally I'll share with you some updates from our adolescent health centers. So we do operate in the Shelby Schools and Adolescent Health Center, and then in Hart and Pentwater Schools we have a wellness center that provides behavioral health services to students. And so these numbers are from October 1st of 2025 through March 31st of 2026. And so in the Adolescent Health Center, the Shelby Adolescent Health Center, which has a primary nurse practitioner as well as a behavioral health counselor, there have been a total of 218 unduplicated clients. So 218 individual students have accessed services through there. Medical visits, and some of these may be multiple, would be 252, and mental health visits or behavioral health services would be 396 services. In Hart, which just provides a counselor for behavioral health services, we had 37 unduplicated clients, but a total of 302 mental health visits or services that were provided to those individuals. And then in Pentwater, there were 29 unduplicated clients and 271 mental health visits. Now, Pentwater is a little lower because our provider there was off on maternity leave, so we were pulling other people in to kind of cover that service, and they weren't able to be there all the day. So that's just a quick snapshot of what's going on at the individual wellness centers that we have going on in the county. Related to the Community Health Improvement Plan, which is this document that you have right here, you do see the priorities that the community members who participated in the prioritization process identified. And so we try to make that as widely known as possible to individuals to be engaged in that process. but at the end of the day, it's going to be those people that show up that are going to kind of determine what those priorities are. And so what we've included in our plan, the priority areas are access to health care, mental health and substance use disorders, chronic disease and healthy weight, and then economic stability. And so underneath each of those, you'll see the justification or the data that was used to kind of pick that as a priority area, and then the goals that are there. And then not just District 10 strategies, but also other community partner strategies that are all working towards that same process. And again, this is part of the My Thrive initiative, which is a 31 county initiative. Includes all the 7 health departments that cover those 31 counties, and then the health systems and other human service providers in those communities. And so actually planning has started for the next round of the community health needs assessment, as the hospitals are required to do this every 3 years. So personally, it'd be better if it was a 5-year process, but we have to go by what the hospitals are required to provide as we collaborate with them and work together to try to avoid duplication and increase efficiency with those services. So if you have questions on that or anything in the annual report, you can reach out to me, or you can let Paul and Bob know, and they can track me down at a board meeting.
Paul, may I?
Yes, sir.
One thing that I recognized very early on being on the board was District 10 Health Department covers 8 counties, and we have the common goals that are set by statute for the health department, but it's not a cookie cutter for each county. Each county is different, and Newaygo County has, you know, clinics that they deal with and stuff. And Kevin, can you just in a couple minutes, can you give us a breakdown of a couple things that are specific to counties that you don't do in all of the counties?
Well, at the Adolescent Health Center, the school-based wellness centers, really those are grant-funded initiatives, and those are not in each of the 10 counties that we cover. Those really are determined. I mean, we can write the grant, submit it in, but really we need the buy-in from the school and the community partners as to whether or not they're going to be willing to invest in putting something like that in their schools. So that's an example of something that's not across all 10 of our counties. Some of the opiate reduction, substance use prevention initiatives that we're doing, there are some things like the Narcan vending machines that we have in all 10 of our counties, but other more educational strategies and specific things really are dictated by the individual counties and whether or not we can find resources to do those services in the counties. So those are just 2 quick examples of what those are.
Mecosta County, didn't Mecosta County contract with the health department for?
They did. Mecosta County, and each county is a little bit different structure in terms of and time frame where they're at with their opiate settlement dollars. Actually, Mecosta County reached out and asked District 10 to kind of coordinate their disbursement of opiate settlement funds. So, and it's again not determined by the health department. There is a community-wide coalition or committee that gets together, an advisory board that gets together and reviews the RFPs that come in, and then we'll make the determination of where those processes go out. Some of the other counties, Lake County, Wexford County, Crawford County, we have a representative that will sit on their committees and will review processes and make recommendations. Other counties, they're kind of operating it all in-house. So everybody's a little bit different as to where they're at with those.
Thank you, Kevin.
Mm-hmm.
Kevin, of interest, that I think it would be interesting for you to explain this, the infusion spas that we spoke of last month. It's the most fascinating thing that, after you told us how this worked, could you tell the commissioners?
I can try to remember how Dr. Morris kind of shared this. This was really something that raised a question. I don't remember how it came up. But you may have seen I've noticed them down when we were vacationed down in Key West. There were these places that I think they were marketed as more of a hydration type of center. So kind of aiming at the people that were hungover. You could go in, they'd hook you up with an IV, and you get your fluids and be back good to go. It's kind of similar to those type of things, but they might be also services that are offered in certain spas. And the challenge and Dr. Morris's frustration with those is there's not necessarily an oversight committee or an inspection necessarily that gets done with some of these. So there is still a bit of a loophole in terms of being able to offer some of these services. And so working to try and tighten that down so that we can assure the safety of the clients or individuals that may be using those facilities.
Yeah, and the interesting part is we have to license tattoo parlors, we have to license barber shops, but we don't license or police intravenous injections.
And the other thing was, one of our fellow commissioners from a different county said that just within a short period of time before that, her daughter asked her to come and watch the kids because she would go into the spa to get an infusion. It's out there, and I never even realized it was out there.
I didn't either. No.
It's all out there.
Yeah. Could you expand on measles a little bit?
So right now, obviously, there are 8 cases of confirmed measles in Michigan. Those are since March. Started down in Washtenaw County. It's being attributed to actually an individual who was in Florida, brought it back. All the cases are related from contacts that they had. And then there was a recent case, would have been last week actually, that cropped up in Monroe County. Not sure yet if they're able to kind of link it back to the Washtenaw County case at all, but kind of keeping an eye on that. I know I was talking with Claire, our communicable disease coordinator, this morning, and we have gotten a number of calls recently from providers and that found out that there has been some testing going on within our communities and jurisdictions. Some we know about, some we don't know about, so on suspected cases of measles, but knock on wood, we have not yet had anything in this jurisdiction, and hoping to kind of be able to keep it that way. The challenge with measles is it is probably the easiest communicable disease to transmit, because once it gets airborne, it's tough to. If you're around somebody with it, there's a good chance you're gonna
Take it home.
Mm-hmm. And the other interesting thing with all of those cases in Washtenaw County is, in every instance, one of the contact sites was a healthcare provider related organization. It could be a hospital, it could be an urgent care. So, you talk about the workload that goes into that. You have to go back now and try to identify all the individuals that person may have come in contact with when they were in that facility, and then do your contact tracing and case investigation with it. So again, one case can result in a whole bunch of work for the staff that are involved in doing that.
And we are the largest geographical health department in the state.
We are, yes. District 10 is the largest geographical size health department in the state of Michigan, population-wise, depending upon whose numbers you're looking at, anywhere from 10 to 12.
Mm-hmm.
So.
And out of the 10 counties, we are the second highest in opioid overdose deaths.
Yes, in the jurisdiction. Yep.
Mm-hmm. Manistee is the only one above us.
Mm-hmm.
Thank
Very
you,
good.
Kevin.
Okay.
Thank you, sir.
All right.
Appreciate it.
Yep.
Oh, and I've got to add, Kevin, thank you. The staff reductions and the budget reductions, I don't know as if I've ever seen a smoother transition and a better handled problem than you've handled.
Yeah, the leadership team was very efficient in having to deal with that situation this past year. Hoping we don't have to go through that again, but we shall see.
Thank you, sir.
Yep.
And at this time, I would like to introduce Stephanie Moore, our Executive Director of the Oceana Council on Aging.
I'm deferring to.
We're going to
Gwen.
defer
Gwen
to
is going
Gwen
to.
Ann.
Not Stephanie.
That's okay. Hi, Gwen.
She will come up a little bit later. Good morning.
Good morning.
My name is Gwen Adams. I manage development and community engagement for Oceana County Council on Aging. We're very excited to present our 2025 annual report to you today. I won't go over every single page of the report, but I'll just highlight a few things before Stephanie joins me up here to talk more about the budget and some big picture things. So I'll start with our mission, which I believe is on page 16 of your packet. Our mission at the Oceana County Council on Aging is centered around promoting and safeguarding the independence and well-being of individuals age 60 and older. We have been in operation for about 55 years. We achieve our mission by providing vital services, comprehensive information, and support to the residents of Oceana County. Our commitment to this mission is unwavering, as we strive to enhance the quality of life for our seniors, ensuring they remain active and engaged members of our community. The next page is our board of directors. As a nonprofit, we are governed by a board of directors who bring valuable knowledge and expertise to help us advance our mission of supporting seniors, their caregivers, and their families. Together, this board is vital in supporting and enhancing the lives of seniors in Oceana County. Along with our board, we have many partners and collaborators that we work with to achieve our mission of supporting seniors. They come from the local, state, and federal level to help us meet those needs. Some examples of partners and collaborators are the Hart Public Library, our Oceana County Sheriff, the Michigan Department of Health and Human Services, National Council on Aging, United Way of the Lakeshore, among many more. We also collaborate with the MSU Extension to offer health and wellness programming. And this spring we're very excited. We have a group of 4-H students who are helping us with our community garden, which, as Mr. Kelly mentioned a little bit earlier, is a really important asset for us, especially considering the SNAP program changes. We're very grateful for the support of these partners as we work together to address the evolving needs of our seniors. On page 20, we go over some of our services and programs.
Excuse me a minute.
Yes.
We have 2 different page numbers here.
Yeah, so it's the one that's red, so you're
Okay.
the big packet.
Okay, so everybody's on the same page.
Yes,
I
absolutely.
was mixed up first, so.
No,
thank
you're
you.
fine. Thank you. The Council on Aging values individual uniqueness and supports seniors by providing a range of services, including in-home care or community living support, transportation, respite care, and adventure travel. We also collaborate with trusted organizations like Parmenter Law to address needs that fall outside of our scope. So some highlights specifically from our 2025 report. We did have a change. New in 2025 is the State Health Insurance Program, or SHIP. Navigating Medicare and Medicaid can be complex, and SHIP provides trusted information and resources to help seniors better understand their benefits and make informed decisions about coverage. Our Senior Care Services Director, Jackie Smith, is currently the only SHIP certified counselor in Oceana County, alongside a volunteer who is in the process of becoming certified. This service is offered at no cost, with a focus on education and guidance, helping individuals understand their options, not selling a plan. On page 24, we have those statistics. In 2025, we had 75 clients that received services for SHIP. On the next page are some more of our statistics. I'll go over a few key ones. Our Friends House, which is part of Oceana County Council on Aging, provides respite care in a safe environment with trained staff, offering personalized programming, daily exercise, and nutritious lunches. In 2025, 4,672 hours of care were provided at our Friends House. The Community Living Support Program, also known as in-home care, provides essential care at home, assisting with tasks like housekeeping, meal prep, personal care, and caregiver respite. In 2025, 7,341 hours of community living support were provided. I also want to share a mission moment that we have for our Adult Day Center, our Friends House. We have a client who is on a hospice, but 3 months into attending our Friends House, they have graduated off of hospice care, which is a major positive impact on their health. So we're very excited that the Adult Day Center has had such a great impact on our families and seniors that utilize that service. On page 26, we have transportation. The transportation program highlighted in our annual report offers door-to-door bus services throughout Oceana County, allowing riders to travel anywhere within county lines for visits, errands, or appointments. Additionally, the volunteer driving program provides transportation for out-of-county medical appointments, essential for seniors needing treatments like dialysis, ensuring safe and reliable access to care. On page 27, we have our transportation statistics. I'll highlight just a couple numbers. I want to highlight our volunteer driving program, which logged 46,956 miles with a total of 1,063 trips. For context, and for those who may not know, Oceana County has no dialysis services. Anyone who needs this life-saving treatment has to go out of county. Dialysis is the most frequent request that we have for volunteer driving. And despite the dedication of our volunteers, we never have enough drivers to fully meet the demand. We are very grateful for the team of volunteers, along with our dispatcher, Deb Hartman, and Transportation Director, Lisa Nagel, for their work on finding and scheduling volunteers to ensure those individuals get the care they need. We also wanted to highlight transportation efforts during the 2025 government shutdown between October 1st and November 12th. 2,087 total trips were provided over 31 work days agency-wide during the shutdown. Only 6.5% of those trips were classified as essential. The other 93.5% were deemed federally non-essential and were made possible thanks to the millage. So, what is non-essential? The federal government shutdown deemed several vital services non-essential, including caregiver support, congregate meals, disease prevention, elder abuse education, legal services, kinship care, and non-medical transportation. These services are crucial for community well-being, especially for our seniors. The shutdown limited access to these supports, but thanks to the millage, trips to these types of services were still possible for Oceana County seniors during the shutdown. On page 28, I want to finally highlight some of our 2025 programs. Social engagement and activity are essential for healthy aging, and we are fortunate to offer a wide variety of experiences. These include trips to Grand Rapids for events like the Lantern Festival and Broadway musicals, as well as adventure fitness opportunities such as our kayak group. We also continue to bring the arts directly to our center by partnering with local high school bands and the ukulele group, the String-Alongs, who generously donate their time not only at the main center, but frequently at our friend's house. Many clients at our friend's house face barriers to attending arts and cultural events, so we are especially grateful to partner with people like the String-Alongs as they bring the joy of music directly to them. Finally, thanks to our generous partnerships with local church organizations and the Community Foundation for Oceana County, we were able to deliver care packages to over 30 seniors in all corners of the county during the long Christmas holiday break, spreading connection and support to those who need it most. On page 29, we have our center program statistics. Volunteers are essential to our programs, contributing over 4,000 hours in 2025. We also emphasize intergenerational experiences, recognizing that aging is a shared journey involving seniors, their families, caregivers, and friends. Our programs encourage family participation, such as the free trunk or treat in October, allowing seniors to engage with their grandchildren and volunteer by hosting trunks to distribute candy, fostering meaningful connections across generations. And at this time, I'll ask Stephanie to join me up here so that she can share some more about our budget for 2025 and some big picture thinking. Good morning.
Good morning.
Good morning, Steph.
Thank you.
So looking at our budget, it is a big budget, right? But when you look at the hours of service and what we're able to provide for Oceana County, I do want to highlight some of those facts. We continue to be an example for other organizations looking to grow their programs. We are one of the most complete wraparound services in the state of Michigan for what we provide to the population of Oceana County. That includes transportation as a vital source. Without that, we could have all the most wonderful programs in the world, and how do people get there that don't drive, right? So being able to have one central location where people can come, and they can come for an exercise class, have a meeting with our SHIP counselor to go over, insurance options, stay for a healthy lunch, engage with friends, mitigate social isolation, which we have now learned is just as detrimental to health as smoking 2 packs of cigarettes per day. What we have found with having that single location is it brings people together in the community rather than siloing them. There is a great aspect to say, yes, we could have we could have satellite sites, but as we've seen in other counties, in Muskegon and Kent County, for example, there is no one central location. They do have their area agency on offices, or area agency on aging offices rather, that people can go to, but that does not give them the chance for socialization, and again, the important impact of that. So that's one thing that we do very well. We're always striving to see how we can grow. We are doing a lot of outreach. Having Gwen join the team has been a huge asset to us. We've also really grown in the Hispanic community, and making sure that everything is transitioned into bilingual language, making those barriers non-existent as possible. So when we look at that now, we've been able to utilize our millage now. Previously, it was close to 80% of our budget was millage related. In 2025, it was actually 58.5%. So we are able to reduce that. We're utilizing those, but we're growing our programming, expanding our services, but also being able to utilize other grants that we have had opportunity to apply for and be granted with. Some of those we just last year in November, MDOT, our partnership with them, we are in desperate need of a bus garage. We currently have 8 buses and 2 additional vehicles, and we only have a 4-bay bus garage that is about 45 years old. Not meeting those needs. We've had some vandalism issues, things of that nature. MDOT came through with a grant for us totaling $1,007,000, allowing us to build that. We have a 5-year leeway to get that done, and we're actively working on that now. We also have a new partnership with Michigan Health Coalition, and Rand Corporation has reached out to us after hearing about the impact that we're making in Oceana County. Having national organizations reach out to us and want to partner has been a big step in showing that we're providing those services and advocating on behalf of the seniors in our county. So I also would like to point out that Michigan is the 15th oldest state in the union. In Oceana County, the state average is 19.5% for those 65 and older, and it does vary because some studies only go by 65 and older, and some consider 60 and older. We provide services to those 60 and older for anything that's millage related, so community living support, adult day program, things of that nature. Meals, those can be for a different fee. Can be provided to those under 60. But in Oceana County, we sit at 22.5%. And again, this is for age 65 and older. So that's a pretty big impact. About 26% of the population of Oceana County is over the age of 60. And it's projected by 2040 that that's going to jump another 20%. So as Gen X turns 60 this year, and we're looking at the baby boomers, and then we still have some of the silent generation with us, which is amazing. We're looking at 3 generations of services and how we are looking at being able to spread those services to make it fit for all generations, which is a challenge in and of itself. So again, we're utilizing grants as much as possible. We are very fortunate to have this millage. It allows us to look at different options, again, to keep people engaged, independent in their homes as long as possible, with the idea of aging in place. We see a lot of our retirees that are here from maybe other places, because this is where they retired to after vacationing here during their working life, and this is where they would like to remain. And with partnership with the medical care facility and our agency and the numerous other agencies in the county, we're able to help do that successfully. And with our transportation too, it's been a big benefit to other businesses. We did have a transportation director, and unfortunately she's out ill, so she didn't have the numbers to give me. I didn't want to bother her, but she did send letters out to 32 of the frequently utilized businesses and organizations that we provide transportation to in Oceana County, just to share with them the impact of what having the transportation service available in our county can do, and the impact it can make in the business world as well. So, does anybody have any questions for me?
I'm curious. My understanding is that with that transportation grant for a bus barn, we're not allowed to build it on our property. We need to find another location.
There's been some, yes, we're still trying to filter through all of that, and right now our project manager with MDOT has moved to a different area, a different section of the state, and so we were introduced to our new project manager before we got to actually meet that person. We are now on to our third project manager. So there's been some shuffling around at that level, and so we're still waiting for answers from them. I have been in contact with Congressman Molinar's office. They sent us back to MDOT. So we are still filtering through all of that, but there are some opportunities that maybe we can have some adjacent properties available to us, but we're still working through that process and waiting to see.
But they won't let us build it
Because it wasn't part of the NEPA. When we purchased the property back in 2018, there wasn't a NEPA study done on it, and so, but we didn't know back then, right? We only knew what we knew, and so without that being done, that then brings our current challenge.
Did you consider a land division and leave it right, put it on a different parcel?
We've asked those questions, and we're making sure that what we're doing, we want to make sure that everything we do is on the up and up and legal. So you know, we've asked the questions. Now it's at the federal level. I will be in Washington in May on Capitol Hill and have appointments with all of our federal government officials at that time. So we'll see. I don't know. I'm not holding my breath for it, but I'm hopeful that at least maybe we'll have some answers coming forth sooner rather than later.
Yes, sir.
I was asked to serve on a committee just to help brainstorm this transportation building, and so there's been a lot of this, you know, we look at that and scoff, you know, it's the wonderful inflexibility of grant language and what would make sense and what would be dollar efficient versus what grant writers deem as the parameters often don't mix real well. So they're pursuing a lot of different angles in doing due diligence, not to just say, well, this is, you know, let's ask the questions, let's see if there's a creative way to manage that expectation but not have to spend dollars on land that's already there and available, but they also at the same time are exploring adjacent properties that back up or align with the current property if there's no way around a ridiculous stipulation. So all those questions are in play. Unfortunately, dealing with a federal grant that funnels through MDOT there's a lot of layers of communication required to get real answers. So it's a process.
It's oftentimes a lot of hurry up and wait. We're still waiting to take delivery on a vehicle they granted us in 2021. So
Wow.
And our present barn is up by the DPW.
Yep.
yes,
And it's a 2-bus barn, 4-bus
Four
barn.
stall.
And they won't allow us to improve or expand that one.
Well, there's no space there
There's
either.
no space to adequately add what we truly need.
So we would abandon that barn and go
We
go
would
back
still
to the
utilize
city.
it. We would utilize it. We've got some ideas, but so, and we have to be cautious too, because even though we might have some ideas of adjacent properties, until we do our due diligence, you know, we really can't be in contact with anybody, and I don't want to.
They're
set up
allowed
any-
to talk to owners about the idea, but there's no allowance for price discussion or any deals to be made. It's
Right.
I think the grant essentially says, well, you can talk to a landowner and tell them you're interested, and that's about it, is my
Right.
understanding.
So we want to make sure all our ducks are in a row before we move forward with any of those conversations and create any issues that might come along with not having that fully vetted before we move forward. So.
Any other questions?
Thank you, Stephanie.
Thank you.
Thank you.
Thank you. Ms. Seelig?
Hello. Judge
Good morning.
Fox was planning on being here, but his schedule was hectic, so he wasn't able to. Oh, sorry. I think Tracy already sent out the proposal, what we're asking, just to increase our collection clerk's hours from 28 to 35, which is per biweekly. This change is only going to impact $153. $1.11 per the biweekly pay period. Tracy sent out an email asking if my budget can cover the cost instead of increasing it. It can, so we would just be doing internal fund adjustments to increase that. That's it. Questions?
$300 a month.
It would be $306.23 a month.
Yep. Or $3,700 a year.
Oh, very good.
Oh, what, may I?
Mm-hmm.
We're gonna do this on a trial basis.
We're going to do it on a trial basis, so we're asking for the 35 hours. Angie currently works 2 full days a week, so we're going to be trying to figure out her hours to have her come in so that she can do all of her duties.
Is there a sunset on that trial basis?
No, we're just hopeful because currently it's only a part-time. We want to keep it part-time.
No, is there a length of time you're gonna try it to see if it works?
3 months.
3 months, 90 days. The only concern that I have, and economically I can understand what you're talking about, the only concern that I have was when the judge came and talked to us about the increase in wages for the people for the court reporting. He said that there was gonna be no need for any additional hours or any additional services in the court system at that time.
For the court recording, yes.
He said in the court system.
Okay.
That's what the judge said.
So, I think he was looking just into, in general, just the recording aspect, not in,
Okay.
so yeah.
Thank you.
Yep.
Thank you.
Thank you. Department head report.
If I could just share with you real quick, Sheriff Massey's gone today, but thank you to the Council on Aging. We recently kind of have entered a partnership with them as well, talking about transportation for reunification sites in the midst of a critical incident at our schools. And so this is a huge need, and so I'm super thankful for Stephanie and her team and their willingness to have this conversation and see what that might look like. So it's a huge priority for the School Safety Committee countywide, and so this is a huge step, and so I'm thankful for their team. It's a great conversation we've been having.
Thank you, sir. Would there be any public comment? Any public comment? We will stand adjourned. Mr. Hardy? All right.
Craig?
Yes.
May I say something?
Sure.
For the people who had presentations for us this morning, we understand that you're busy. You can stay for the meetings if you want, but you're not going to offend any board members if you have things you have to do.
Right,
You have to
yeah.
Use your time well.
That's not a problem.
He's saying.
Thank you, Craig.
Okay. All right, I'd like to call to order the Finance and Administration Committee. May we have a roll call, please?
Mr. Hardy,
Here.
Mr. Beggs,
Here.
Mr. McCormick,
Excused by the chair.
Mr. Erickson,
Here.
and Mr. Walker.
Here. Thank you, Joseph.
Yes, I'd ask for approval of the meeting minutes from March 26, 2026.
I'll make a motion.
Support.
Motion by Beggs, supported by Erickson. Any discussion? All in favor, aye.
Aye.
Opposed, same. Motion carried. Are there any changes to the current agenda? Hearing none, I'll ask for approval of the agenda.
So move.
Support.
Motion by Erickson and support by Walker. All in favor, aye.
Aye.
Opposed, same. Motion carried. Is there any public comment at this time for Finance and Administration Committee? Hearing none, we'll move on. Jessica Point, Finance and HR Coordinator for County Advisory Tax Limitation Committee appointments per MCL 211.205K.
So all these members that we're looking to have appointed are all members that are required by the MCL. There is a meeting that will be required out of these folks within 10 days after being appointed by the Board of Commissioners. That meeting is scheduled for April 15th, and all the appointees have been notified and they're all agreed to the date and the time. You'll see that the board or the school has 2 people, and they weren't sure who would be able to attend, so they asked that we appoint both of them, but only one will be in attendance at the meeting. And that's all that Tracy had.
Mr. Hardy, I bumped into Paul Inglis at a car dealership last week, and he has done this before. And Paul Inglis asked me if it was the thought that he could take the lead, and I said that's going to be up to the committee when they get together, but at least we have somebody on this board who has been through it before.
Right, yeah, and I think that the way that goes, the way I read the rules, our appointee, which is Rusty Freilich, would basically start the meeting, and then the board would nominate a chair, and then go from there. I think it's appropriate that it's tax day.
Right?
That was a thought.
Any questions or comments? All right, well, moving on. Jessica Mason, Oceana 911 operating millage resolution 26-07.
It's being requested by them to be approved by the voters at the initial 1.4 mils. In 2020 it was renewed and then rolled down to the level of 0.1394 because they had Hadley, rather than the initial 0.14.
Okay. Any question?
I looked at the fund equity, and the fund equity is doing quite well with 911. I think when we set the millage, it's something that, you know, maybe we can get a little bit more information on.
Yeah, I think they have a meeting planned for next Wednesday.
I realize all of this stuff is really expensive.
Yeah.
But you look at...
I know that they have some software upgrades that are coming that are going to be,
well,
expensive.
Yeah, and some of that software, the existing software has not worked very well for any. One of our neighboring counties is in a multi-million-dollar lawsuit over it because they went to somebody else because it was not working with the size that it was.
Yeah.
And provider has filed a multi-million-dollar lawsuit against them. And you know,
I'll see what information I can find.
Well, it's a shame. It appears as though they had a good salesperson.
Yeah, I know that they were concerned because landline usage is actually going away, and some of the funding that comes through the landlines, and we don't recuperate all the cell phone because of their
from a
vacationers.
Seasonal, you know. I think we are very fortunate to have the 911. I think the 911 works very well.
Yeah.
With everything that they have to deal with. I'm glad they're here, and I'm glad they have a fund equity, but it's our task to just make sure that it's not it's not,
Correct.
Yes.
I don't remember the specifics. I do remember a couple meetings that while Craig was sunning himself in sunny Florida, I attended, and Ray, the director there, had some easy explanations for fund balance with some earmarked projects and some upcoming costs. So there's the director there will be able to provide some clarity on that and help us understand if there's anything that we need to look at closely.
All right. Anybody else? Jessica, again, Oceana County Emergency Ambulance Millage Renewal Resolution 26-08.
The ambulance millage request is for the initial amount and is a renewal and restoration. Tracy also has noted that both the millage languages were provided by our county council and reviewed by our equalization director.
Yes, Mr. Walker.
And I'm going to say this every time this comes up. We call this an ambulance millage, and it is also for our emergency first responders for the fire department. We supplement them for this, and if we don't have the millage for one, we're not going to have the money for both. very important millage for the people in Oceana County.
Yeah. That's,
Especially with, you know, Hart Fire Department's gonna start taking more calls.
yeah.
We're okay, you know, and with us asking for that update of where we were funding all last year, you know.
Right.
It covers it, but it varies.
Gotta be watched.
Yeah,
Yeah.
it's gotta be watched, but this is a life-saving millage.
Yeah.
The best way to put it.
All right, Jessica, I'm
may-
sorry.
May I?
Yes.
Under Scheller, you kinda indicated that you're not in disagreement with it being a life-saving millage?
Absolutely. The first responders in the county, they're providing a service that is absolutely necessary, given today's times and expectations for access to healthcare. So it's
Thank you,
thankfully,
Mr. Hardy.
Jessica, again, Administrator's review of selected claims for payment and the Administrator's report.
So she has your claims of payment provided and an administrator's report also in your packet. Does anybody have any questions about anything that she is?
I have one question, but it's actually for the undersheriff. I see the storage barn door replacement is invoices in here. Is that project complete, looking good, or probably complete, maybe pending some concrete work or something
Nope,
like that?
concrete's poured.
Oh.
I went up there last weekend after I got home from sunny Florida and to check it out because the boys told me it was done. Everything seems to look good. Everything's operational. I didn't know it made it into the bill cycle. So I'm glad it's getting taken care of.
Yeah.
Great.
There.
Okay, thank you.
Great. All right, any other questions, comments? Moving on, department head reports.
Ryan?
You're it? If not,
All is quiet. The sheriff's gone.
there you go. Any public comment at this time for Finance and Administration Committee? Hearing none, we will adjourn the Finance and Administration Committee and take a recess till 11:30 for the regular board meeting.